welcome to The Explainer. Today, we are diving into a huge trend that's all over skincare right now, estrogen creams. There's so much buzz, but what we really want to know is, can they actually improve wrinkles? Let's get into it.
So to really understand what all the hype is about, you've got to start with a more basic question. For so many people, menopause and perimenopause can feel like they bring on these sudden, really dramatic changes to their skin. So what's actually going on in our bodies to cause that?
Well, you probably guessed it from our topic today, but the answer really boils down to one single, incredibly powerful hormone, and that's estrogen. Okay, so if we're going to figure out if these creams actually work, we have to start with the science. What is the deal with estrogen in our skin? How are they connected? And this right here is the heart of the matter. This is the direct link between that hormone and what you see in the mirror. As your estrogen levels start to drop, your skin just doesn't hold on to moisture as well, and it doesn't heal as effectively. But here's the real kicker. You start producing less of all the good stuff, collagen, elastin, and hyaluronic acid. Those are the molecules that keep your skin looking plump and firm. Which, of course, leads us to the most logical next question. If a lack of estrogen is causing the problem, then could applying it directly to our skin be the solution? Can these creams actually turn back the clock? But wait, before we get into whether they work, it's so important to know that not all estrogen creams are the same thing. So let's break down the two main types you're going to hear about. Okay, so on one side you have prescription vaginal creams. These are actual hormone replacement therapy. They've got a potent form of estrogen, like estradiol, and they're designed to be absorbed systemically, meaning into your bloodstream. Then, on the other side, you've got your over-the-counter anti-aging creams. These usually use much weaker estrogens or even plant-based compounds called phytoestrogens, and they're just meant for the skin. And here's a really important piece of info from the dermatologists we're looking at today. People are sometimes using those stronger prescription-only vaginal creams off-label on their faces for skin concerns. That's a huge distinction to remember as we dig into the proof. All right, so now we know what these creams are and how they're supposed to work. It's time for the main event. Does the science actually back up the promises? Let's weigh the promise against the proof. I think this quote from Dr. Mariana Blumen-Karasik really sets the stage perfectly. She says the results are moderate and optimistic. So, there's something there, but it's not exactly a miracle in a jar. So what's all that optimism about? Well, there are a bunch of studies, though they tend to be pretty small and a bit older, that have shown some really positive things. Like they've seen an increase in the skin's own hydrating acids, better skin thickness, and less dryness, dullness, and thinning of the skin. But, and this is a really big but, we have to look at the flip side. Dr. Christina Collins points out that long-term studies on safety and how well they work are, pretty limited. And here's the key problem. Most of the research that does exist was done on prescription-strength estrogen, not the stuff you can just buy over the counter. And that lack of long-term data brings us to a really critical piece of this puzzle: the potential risks and side effects of putting hormones directly on your skin. So here's the thing. Even though you're just putting it on your skin, some of that estrogen can actually get absorbed into your bloodstream, and that can lead to systemic or body-wide effects. We're talking things like breast tenderness or even changes in other hormone-sensitive tissues. So because of these potential risks, experts are super clear about who needs to be extra careful. This includes younger people who still have normal estrogen levels. It also includes anyone with a history, personal, or family of hormone-sensitive cancers, like breast or uterine cancer, or blood clotting disorders. For these groups, the advice is pretty simple: steer clear. Okay, so after we weigh all the pros and cons, the kind of limited promise against some of these real potential risks, what's the final verdict from the dermatologist? Where should you be putting your time and your money? The consensus from the experts is actually pretty straightforward. Dr. Brendan Camp sums it up perfectly right here. Basically, until we have a lot more solid evidence for estrogen creams, the best bet is to stick with the skincare ingredients that have a long, proven track record. You know the ones: retinols, vitamin C, and of course, a good daily sunscreen. And that brings us to a super simple action plan. First, trust the classics, the things we know work. Second, if you're curious about trying something new, verify it. Look for things like third-party testing to make sure it's a quality product. And number 3, the most important step for any new treatment, especially one with hormones, talk to your doctor, always. So we end on this big question. Is the future of skincare hormonal? Maybe. These estrogen creams are really interesting, but for right now, they're kind of in this gray area between promise and proof. So while the future might be hormonal, the dermatologist's verdicts for today suggest that the best answers might just be hidden in the tried and true products we already know and love.